very important. Okay, and this will go in the hamper. And then I'm just gonna go down to Jane's leg area. So I'm just gonna keep her as covered as possible, get her leg out here, and just put another towel down. Okay, Jane, I'm just gonna put your leg under this towel. Okay, how are you doing? You doing okay? She says, yeah, I'm doing great. So I'm just gonna put some soapy water on this. And again, long strokes upward, not getting into the peri area at all. Just long, gradual strokes. Make sure to get everything clean. Everything looks really good. Okay, now I'm just gonna grab a lukewarm cloth and rinse it off. Rinse it off, rinse it off, rinse it off. And then, luckily for me, I have a towel right here just to dry her off. And okay, so Jane, I'm just gonna switch my gloves here because they've been on for a little bit. And I'm just gonna wash my hands again and put on some new gloves because I'll be doing your feet care just next. So how are your grandkids, Jane? She says, oh, they're doing great. They're growing up real fast. And I said, I know how that is. I have a 3-year-old and I can't believe he's 3 already. But boy, they're sure fun. And she agrees that kids are really fun to have around. So anyways, if I could get my glove on here, Jane. Okay, we're just gonna go right into foot care. So I'm just gonna do the mitt again on my hand with soapy water and just clean her feet really well. Clean the sole of the foot, clean in between the toes, make sure they're really clean. Do that. And then I'm gonna take just a warm washcloth and then just rinse it all off, get in between the toes again, make sure everything looks great. And then, Jane, I'm just gonna dry it off. And actually, I can take this is gonna be clean, by the way. And then just dry her toe off, dry in between the toes, make sure everything looks really good. Looks great, Jane. And for videoing purposes, again, I would do this on the other leg and the other foot if I was doing this in real life. I'm gonna take that out. Okay, Jane, how are you feeling about your peri care today? Do you feel like you can assist me at all? And she says, no, I don't think I can today. I'm feeling pretty weak still. So that's totally fine, Jane. I'm just gonna change my gloves again and wash my hands, and then we'll get started on your peri area. And I would obviously make sure the curtain is closed while I'm doing all this procedure because we want it to be private. So Jane, that weather outside is awesome today. When you get out of this hospital, you can go out and just have a great time with your grandkids, play outside at the park or something. It would just be great. She says, yeah, I'm probably going to take them to the park when I get out of here and get moving again. I said, it should be shortly, Jane. Okay, now Jane, it's in the soapy water again. Get my mitt. So I'm going to try not to expose you as much as possible, Jane, but I'm just going to have to clean down in your peri area. She says, okay, so I'm just going to go from the front to the back, do a swipe on the side, use a different part of my rag, and do the other side. And then, this has soap on too, by the way, and then grab a whole new rag and go straight down the middle. And she says, oh, that feels great, I feel clean, thanks for doing that. And I said, oh, no problem, that's my job. And then this is just a clean, warm rag just to get that soap. So then I'm going to use a different spot to swipe the other side. And then this is a whole new rag, just water on to go down the middle. And then, Jane, I'm just going to also just dry you off here. Make sure everything looks dry and looks good. You don't want it wet down there at all. Okay? So then, Jane, I'm just going to put this cover down a little bit and just do your upper thighs. So again, with my mitt, I'm just going to use the soapy water and do her thighs. Use a different part to do the other thigh. Just make sure those are good and clean. Then again, with just warm water, do the insides, clean them off again. And then, of course, just dry the area real well, make sure everything is good. And also, this is a great time for me to do skin assessment on my patient, which everything looks really good. Okay. So at this time, I'm just gonna roll you over, Jane, with your bath blanket on. We're just gonna roll you over. Okay, thank you. And I'm just going to clean your back, Jane. And if there's any other of the peri area from behind I need to get. So I'm going to put on my mitt again. with my soap. Wash her back off, try not to get into the hairy area. And then take it with just clean water, wash it off again. And then of course, just dry in the back again really well. Make sure everything's good and dry. Looks great, Jane. And then, this is a new cloth again, like I said, with soap. Just get the back of the bottom. Just make sure everything's clean. We'll rinse it off with a new washcloth and then dry it again. Looks really great, Jane. You're doing awesome. So Jane, while you're over in this position, I'll try to keep you as covered as I can. And I'm just gonna change your linens. Well, you were rolled over, but sometimes that happens. Just fall over a little bit. So anyways, I'm just gonna change her linens. And I would have changed gloves, of course, but I'm not actually going to because I need to get this done. Because I just touched her bottom, so I would have changed gloves. Again, so I'm just gonna grab my fitted sheet here. Somewhere. There's my fitted sheet. Okay, and I'm just gonna grab my fitted sheet here. Oh, Jane, don't fall over. Doing great. So I'm just gonna grab my fitted sheet here, put it on the side, make sure that everything looks really well. Okay, Jane, I'm just gonna tuck that under you just a little bit, and then I'm just gonna also grab the blue pad, because just for precautionary purposes, just to make sure in case anything leaks or whatever happens. So, okay. So Jane, I'm just gonna kind of roll you back on your side here. There's a little bump, shouldn't be too bad. I might just have to roll you over just a bit, Jane, to grab all my new covers and everything. Okay. And this I would discard in the trash. This would go in the hamper, of course. And Jane, I'll just have to have you scoot up just a little bit. And I don't know what is going on with these tubes down here. Oh, I'm just gonna leave them like that. Okay. I'm just gonna scoot you over, Jane. There you go. You feeling okay? And she says, yeah, I'm feeling really great. And then what I'm just gonna do is put a new gown on, Jane. Feel nice and clean, like you've had all of your body clean, feeling fresh. Everything's looking great. Okay, Jane, at this time I'm just going to remove your bath blanket. There you go. And that'll go in the hamper as well. How are you feeling, Jane? She feels really awesome about being clean. So I'm just going to set your head up a little bit, Jane, so you can see what's going on here. There you go. And then I'm just going to finish her bedding. Gonna put this out here. How does that feel? Good, Jane? She says, yeah, it feels super awesome. So then I'm just gonna put the comforter on, Jane. I know I better turn down that temperature in the room because I turned it up a little when you were getting your bath, but you know, I'll make sure to turn it back down. Oh, I think I got this on the wrong way. There we go. This way. There. Everything's looking really great. Looking really good, Jane. So what I'm going to do is just tuck this part in. Make sure it's under the bed. Sorry, Jane, for that little bump. And then I'll make sure this is not covering your face or anything. There you go, Jane. And then I'm just trying to do hospital corners. Pull this up, do the side, and let it fall back down. And make sure your feet aren't tucked under there, Jane, because I know that can be uncomfortable. Come on this side. Also do a hospital corner. There we go. So how do you feel, Jane? You feel really good about that clean bath and everything looks really well and you feeling good? And she says, yeah, I'm feeling great. So I'm just gonna lower her bed down. So Jane, I hope you have a wonderful day and thanks for letting me do that and got all cleaned up. Now take my gloves off and wash my hands, and that's the end of my skill.